Hello, my name is Imad Absa. I'm one of the pediatric gastroenterologists at the Mayo Clinic, Rochester campus. Today I'll be talking to you about a research study that will be published in the Mayo Proceedings about the prevalence of celiac disease among first-degree relatives. Celiac disease is a common immune-mediated disorder that affects about 1% of the general population. And the celiac disease presentation or the clinical symptoms at the time of diagnosis have been changing over the last 2 decades. It's always been thought that celiac disease is only when patients have malabsorption, chronic diarrhea, weight loss. It can vary a little bit by age between children and adults, but that has been the presumed presentation of celiac, or what's called as classic celiac disease. Over the last decades, we learned that celiac disease, for the most part, doesn't present with the classic presentation. It's only about 1/3 of the patients who will have this classic malabsorptive pictures, where most patients can present with mild, non-specific symptoms or have no symptoms at all. And it's been suggested that for each new diagnosis, there may be 7 or 8 patients who are undiagnosed. And because of that, people always encouraged to have low threshold for celiac disease screening and implement what's called high-risk screening, which is looking at the populations or groups of population who are at high risk and screen them. And that will include patients with trisomy, like genetic abnormalities like trisomy 21, other patients with other autoimmune disorders like thyroid disorders, autoimmune thyroid disease, type 1 diabetes, or arthritis. And another group of high-risk patients are immediate family members. It's been studied, and the rate of celiac disease prevalence among family members have been reported to be anywhere between 5% to 11%. And this is based on screening, mostly on symptoms. The U.S. Preventive Service Task Force recently reviewed that and recommended only screening symptomatic family members because of lack of data and evidence that this would be cost-effective. So in our study, our aim was to assess the prevalence of celiac disease in immediate family members, which we refer to in our study as first-degree relatives, and that will include sibling, parent, or a child of a patient with celiac disease, and also assess how did the screening serologic test, which is using something called anti-tissue transglutaminase immunoglobulin A antibody as a diagnostic test in the screening process. So using the Mayo Clinic electronic medical record between 1983 and 2017, we were able to identify 104 celiac patients, and we called those the index celiac case. And using those patients, we identified their family members who have records in the Mayo Clinic system, and those were 477 patients. Out of those patients, 360 patients were screened for celiac disease. And that is about 80% screening rate, which is higher than many of what has been previously reported as a proactive screening. And then we looked at the charts of those 360 patients and 160 that were diagnosed with celiac disease. And we found that only 6% of those had classic presentation of celiac disease, where the vast majority, almost 66%, had mild non-specific symptoms that was all based on recall after the diagnosis, and almost 1/3, 28%, had no symptoms whatsoever, and they would have been missed or maybe delayed in their diagnosis if we did not proactively screen them for the presence of celiac disease. In the process of screening, the most sensitive screening test that we use now is anti-tissue transglutaminase IgA antibody. And in this group of patients, the test performed very well, and the high value of 9 times upper the normal limit or higher predicted the presence of small bowel injury and villus atrophy that is a classic for celiac disease. So in the group of patients who were screened because of their family history, the test performed very well and identified the celiac disease regardless of their symptoms at the time of the screening. Based on the result of the study, we suggest that general practitioners and gastroenterologists should ask their patients about an immediate family member with a history of celiac disease. And if that present, consider screening for celiac disease. Active screening will identify patients even before they become symptomatic and hopefully prevent long-term complication of undiagnosed celiac disease, which may include nutritional deficiencies, risk of other autoimmune disorders, and also higher risk of small bowel or GI tract malignancies. So the value of screening is to identify these patients with high positive titers of anti-tissue transglutaminase. And most patients will undergo further investigation to confirm their diagnosis. In our cohort, we screened 178 had positive anti-tissue transglutaminase. Only 160 of them met the diagnostic criteria for celiac. So identifying the positive family members with screening test would undergo more likely further testing to confirm their diagnosis, and that will help prevent any long-term complication from undiagnosed celiac disease. Please look for our article in the next issue in the Mayo Proceeding for any details, and feel free to contact me or any of the authors if you have any questions.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.